Hi, I'm Stephen Kay, a licensed psychologist and a psychotherapist at Counseling and Psychiatric Services at the University Health Center. If there's one psychological word that's been overused, that word is depression. We hear it so often that it's normal to think that everybody gets depressed at some time or other. This is not true. Everybody gets sad and blue. This is true, but getting sad or blue for a few hours or even days does not mean that you suffer from depression or a mood disorder. When you're depressed, you feel sad or cry a lot. You get irritated often. Your sleep pattern changes. You may sleep too much, have trouble falling asleep, or awaken several times during the night. Your eating pattern changes. You eat a lot less or a lot more. You're tired most of the time and lack energy. You have trouble concentrating and can't make decisions. You have difficulty getting out of bed in the morning. You stop going to class. You don't enjoy a lot of the things you used to like to do. You feel hopeless or helpless. You want to be by yourself most of the time. You lose interest in sex. You think about death or have thoughts about committing suicide. What causes depression? There is very strong evidence that depression reflects in part an underlying genetic vulnerability. This genetic vulnerability, however, is neither a necessary or sufficient condition for depression. Neurotransmitters in the brain and hormones in the endocrine system also play a role. Exactly what role is the subject of a tremendous amount of current research. Stressful life events, such as a history of physical, emotional, or sexual abuse, can trigger depression. Profound loss can trigger depression. Sometimes it is the cumulative effect of multiple stressors that trigger depression. How do we treat depression? At CAPS, depression is treated through psychotherapy or a combination of psychotherapy and medication. Medication is very helpful in treating physical symptoms. A student who sleeps too much or too little, who eats too much or too little, who can't muster the energy and motivation to get out of bed or go to class, is a student who can benefit from medication. There are many different antidepressants. We know that antidepressants affect the levels of different neurotransmitters in the brain. To say, however, that depression is a chemical imbalance is to oversimplify the complexities of how our brains work. A brief aside, psychiatrists are medical doctors. They have graduated from medical school and they can prescribe medicine. Psychologists and social workers have graduated from graduate school. They cannot prescribe medication. Psychotherapy for depression takes a number of different forms. Cognitive therapy for depression involves changing maladaptive ways of thinking. Depressed people think depressed. That is to say, they overgeneralize, selectively focus on the negative, and discount the positive. These are but a few of the many dysfunctional ways of thinking that are addressed by cognitive therapy. Since loss is a major trigger for depression, therapy focusing on grief and loss can be very helpful. Grief therapy focuses on helping the person accept the reality of the loss, express their feelings about the loss, and adapt to the changes precipitated by the loss. Death is one form of loss that contributes to depression. The breakup of a significant relationship is another. When trauma occurs, depression may follow. When this happens, therapy focuses on helping the person cope more effectively with the trauma. Components of trauma therapy include exploring memories, facilitating the processing of painful feelings, and learning new ways of regulating feelings. Finally, when depression arises from problems in interpersonal relationships, therapy focuses on developing communication and social skills and resolving conflict. Getting help for depression. If you are wondering if you are depressed, you can complete an online depression self-assessment on CAP's website. A student may get help for depression by calling CAPS for a telephone screening. The clinician conducting the phone screening appointment may recommend individual and/or group therapy, or may suggest a referral to a campus or community mental health provider or agency. If individual, group therapy, or a psychiatric evaluation at CAPS is recommended, an initial consultation appointment will be scheduled. If an evaluation for medication is needed, a referral to one of CAP's psychiatrists or a psychiatrist in the community may be made. Crisis walk-in services are available if you are in crisis and are unable to wait for a scheduled appointment. If you are experiencing significant symptoms of depression or are thinking of harming yourself or committing suicide, please call CAPS and speak with a walk-in therapist. Our regular hours are 8 a.m. to 5 p.m. Monday and Friday, and 8 a.m. to 7 p.m. on Tuesday through Thursday. During the summer and break periods, our hours are 8 a.m. to 5 p.m. You may also come immediately to CAPS, located on the third floor of the University Health Center. When CAPS is closed, you can always talk to an on-call crisis therapist after hours by calling the UGA Police at 706-542-2200.